Hello, this is Ryan, and it is, let's see, 1,116 days after transplant, apparently. I went through my videos from the whole transplant experience, thank you, Katie, and realized that they were all still unlisted, so I made them all public for, whatever reason that others might get any kind of benefit from them, or my experience of that whole chemo and bone marrow transplant thing. And I figured I would make a follow-up video 3 years later, just where I'm at now and what's going on and some of the hurdles and other stuff that I've been working on. So yeah, I've still got the Scott Pilgrim hat. Thank you very much, Catherine, for having made that for me. I still wear it regularly, especially now that it's winter and it's actually cold in Raleigh. I also have hair. I think the last video I made, I was rather baldish. I had baby hair. And now I have a mop, I think is probably the most accurate description for whatever I've got going on up there. But at some point I'll probably start getting back into the social norms of doing something with it other than just waking up and letting it do what it does. So, so let me first talk about real quick some of the hurdles that I've had over the last 3 years, because I guess, if anybody actually wants to know about what's been going on. So a lot of the face shape that I've had, the body kind of changes that I've had are related to my continued steroid dependence. Basically, the steroids help compensate for my adrenal glands, or my adrenal axis, I should say, the combination of my adrenal glands, also the pituitary and the thalamus, I think, or something like that. That produce cortisol, they no longer really work well for me, and that's kind of probably a side effect more of the chemotherapy and the treatment that I went after the bone marrow transplant. But I think also possibly maybe it was just part of my physiology prior to most of my life. But who knows? It's one of those things. So yeah, because of all the steroids I'm on, basically I have this kind of puffier demeanor, and a host of other kind of side effects that are less aesthetic and more practical, and I'll get into those in a bit. So I've also been dealing with, as a side effect of the whole adrenal insufficiency, occasional adrenal crises, which basically is when my body needs a lot of extra cortisol in a rush. Most of our bodies just normally do that for us, and they give it to us, and my body does not. So when that happens, basically I have about, I start getting nauseous, I start getting just noticeable physiological symptoms, and if I don't really do something about that, within about 20 minutes I start vomiting and other things, diarrhea, whatnot. Basically it's just, my body just starts flipping out and deciding that it has to purge everything, and if I don't basically at that point get an IV injection of hydrocortisone rapidly within a few hours, I basically have significant fluid loss, loss of blood pressure, and there are sad stories about what happens to people who are not in a situation to get emergency care when that happens to them. So it's kind of a life-threatening situation. It's happened maybe about 9 or 10 times since the whole bone marrow transplant chemotherapy thing. Usually once every couple of months or once every few months, and often I've learned over the years it's in response to either a food allergy or food sensitivity insult, or kind of an environmental insult, like apparently just going to the movies is enough to trigger me into an adrenal crisis and have to go to the hospital. I'm guessing it's a combination of the kinetic visual experience, the loud sounds, that kind of stuff. I don't really know. Like I'm fine watching movies, I feel fine, I'm not like distressed, but suddenly my body's like, no. So yeah, I think the last movie that I went to see was Guardians of the Galaxy 2, and yeah, that put me in the hospital. That was very kinetic. I went back and saw it 2 weeks later and stress dosed with my hydrocortisone beforehand, which just means I took a large amount of hydrocortisone before I actually needed it. And I felt like I actually needed to do that. Like during the movie I still needed to take extra hydrocortisone to not go to the hospital or not feel nauseous, basically. But I was actually able to make it through the movie that time, so it was interesting. And that was just informational for me in terms of like learning about yet another thing that I have to kind of worry about and modulate manually now that my body doesn't do it normally. So aside from the adrenal crises and insufficient hospitalizations, that's also kind of impacted my life in the sense that I can't really travel easily anymore. I can't go up and visit my family in New England or go on a plane flight across the country to Chicago or Houston or San Diego to visit other people that I care about. Because being in those situations means that I might be in a situation like if I'm in the middle of nowhere driving between highways in Virginia and I go into adrenal crisis for whatever reason, if it's injury or insult or sickness or whatever, or just I eat something wrong, I will not be in a situation to get immediate emergency medical care and I might die. So it's kind of a practical concern that's just limited some of the things I can do, and I'll probably end up figuring out ways to deal with it over time, but for the time being I'm happy doing what I'm doing. I've been wearing gloves a lot over the last year, especially these white gloves. People often ask me why I'm wearing gloves, and I've gotten a range of conjectures or speculations that people say, are you a germaphobe? Are you a butler? Do you like Michael Jackson? And actually just the reason is plain and simple, oftentimes just avoiding sun exposure or cold, but for the most part I just wear them to keep my skin okay, because I just have like a chronic kind of dryness now that if I don't have some kind of like protection over the skin, it basically just my skin starts cracking and doing bad things very rapidly, and it takes a really long time to heal if that happens, like weeks or months. And so rather than having painful skin that makes it difficult for me to type and do things, I just wear gloves frequently. So that's why I wear gloves, just in case you ever want to know when you see me wearing gloves. Also sun exposure, because basically whenever the sun hits my skin now, within a very short period of time it starts triggering what's called graft versus host disease, which is just a side effect of bone marrow transplant. It's actually what's helping keep me alive, keeping me from going into remission, or relapsing with cancer. And it just kind of manifests as like a red rash. I've got a bunch of it, you probably can't see in this lighting, but I've got some on my neck and some on my arms, and it's just kind of it will be one of those things. It's a balancing act. If I get too much, it'll kill me. If I don't have enough, then the leukemia might relapse. So it's just one of many different ways I have to kind of maintain a delicate balance by taking the right amount of steroids, using the right medications regularly just to keep things in check. Let's see, a couple of years ago, I think it was 2015, about a year after the transplant, I think I had a fistula, which is not a fun medical condition. You can look it up if you want to. I won't go into details. It's not something you ever want to get. And I had a fistulotomy to correct it, and that worked fine. But then, like during the recovery period, I was basically just sitting a lot, just taking it easy, and kind of had a hip pain kind of just suddenly manifest at that point, and that's been with me for the last couple of years. And I was going through physical therapy for a long time, trying to we all figured maybe it was muscle atrophy related to the recovery. Turns out I had an MRI a few weeks ago, and we discovered it was avascular necrosis, which just is a side effect of all the steroids that I've been taking to keep me alive. The veins or the blood vessels in part of my right femur have kind of retracted, or had retracted a long time ago, and that section of the femur just died. So like the top of the ball joint basically just kind of died and started crumbling. And so when I went to the fistula, or the fistulotomy, and during that recovery period, it was probably like the bone had probably died way before then, and it was just like a sudden, something happened, it just caused the bone to crumble, and that's like when the hip pain kind of started. And so basically, long story short, at some point, if I ever want to walk without a limp again, I might need to get a hip replacement. There are people in my condition that can go for very long periods of time without needing hip replacement. And for the time being, I'm just going to kind of go with the flow, see what it is, make decisions as they come. Because getting a hip replacement's, it's not the worst thing in the world. It takes like an overnight hospital stay, some surgery, and they basically lop off the top of your femur, the ball joint, replace it with a steel point, put some polyethylene liner inside your hip, and you're good to go for maybe like 15 years, maybe 20 or something, depends on the materials they use. They're getting good results with some ceramic kind of new ceramics these days, so I might get that done at some point. It may allow me to even jog again if I want to. It depends. I've heard different things from different doctors. Some doctors, or one doctor told me, jogging and running are never recommended with hip joint replacements. And I had another doctor say, well, you can kind of if you want, but then you'll just need to get another hip replacement sooner. So it's kind of a lifestyle decision. If I had a ceramic hip joint and it catastrophically failed, that would be very painful and would probably put me out of commission for at least a month or two while I was waiting to get surgery and have it fixed. So all those kind of concerns. I'm not really looking forward to it, so for the time being I'll just put it off and hope that my hip doesn't catastrophically fail on its own, because then I'd have to deal with it anyways, and nobody wants that. Let's see, I've had anemia for a time, just low hemoglobin levels. I was iron deficient for a while. We were trying to figure that out. I was on iron supplements for a while. My iron levels weren't really coming up, and I don't really know exactly how that resolved, but it did. Now my blood looks great. I go in for blood checks every month or 6 weeks or so, and for the last few, they've looked pretty good. My hemoglobin levels are on the low side of normal, but that's actually really good for someone having post-bone marrow transplant. So my doctor's always saying, yeah, you're doing great, which I'm very, very fortunate for, which I can explain later. I've had some high blood pressure, so just one of the many, many side effects of being on steroids is just having, I just want to make sure this is actually still on and working. Yeah, it looks like it is. One of the many side effects of being on steroids is just high blood. You can get problems with high blood pressure. So there was I think a brief period where my blood pressure went up to something like 160 over 114. I happened to be in a doctor's office when they measured that, and they're like, yeah, we're just going to walk you over to the next door emergency room, and you might want to stop taking the hydrocortisone. So I had to play with that a bit, and now I'm on a higher dose of prednisone and a lower dose of hydrocortisone, and it seems to be all right for now. Hopefully the high blood pressure doesn't come back, because if I can't be on hydrocortisone, I have other side effects, and they significantly impact my life. So it's kind of it's just a delicate balancing act, and I'm hoping it doesn't fall apart at some point. So, and let's see. For a while, basically fatigue has been a constant problem for all of my life, but it really got worse over the last few years, especially post-treatment, and it's a common side effect that people have after having a bone marrow transplant or that kind of stuff, is just kind of a chronic fatigue situation. So I tried Concerta and Ritalin for a while. I had some real great success initially with it. It was just, I couldn't be on the medication. I was taking even half of a child's dose of it. I was on 5 milligrams, and I was having substantial impact from that. But if I took it for more than a few days in a row, I'd get really kind of jittery, and I'd feel really weird, and so I could only take it for a few days in a row. And I'd stop eating. I would lose my appetite. Not really, I'd be able to eat, I just would forget to. I just wouldn't be hungry anymore. And so over a period of a few months, I was experimenting with that, having some luck and getting more work done, and having some success with being productive or functional, but I was just slowly losing weight over the last year. And basically over the period of maybe January of 2017 to around July, I lost about 30 pounds. I went from 180 to around 178 or so to around 143, I think, was my lowest weight, which for someone who's 6'2", that's actually pretty low. And there was just a period of time right at the end of July where I woke up in the morning. I physically was so weak that I just couldn't get out of bed, and I stayed more or less in bed other than to just get up and go to the bathroom or eat for 2 days in a row. And I was just like, wow, I'm feeling terrible. I just feel like I'm dying, and just made some choices with my doctor's help. Basically, I got off of a few different medications. I stopped taking the Concerta. I stopped taking metronidazole, stopped taking posaconazole, which were 2 other medications I'd been on post-treatment that I just kind of needed to be on for protecting me from bacteria and funguses and that kind of stuff while my immune system was maturing. And I also made the decision when I got off those medications to try to fundamentally change the way I was approaching trying to cope with my fatigue. So up until that point, I'd been trying to allow myself to feel okay about resting, napping, sleeping as long as I needed to try to get energy, that kind of stuff. And that was clearly not working. As much as I slept, as much as I napped, I almost never really felt refreshed from that. It often made me feel even worse. So instead of doing that, I just kind of started waking up. And when I would wake up early in the morning, I would just get up and stay up and do whatever it took to actually stay up and active. And I would just basically, for me over the summer, that just entailed going down to the nearby lake, walking, picking up litter. Whenever anybody would ask me to do anything, I would just say yes, no matter what I was doing otherwise. I would find excuses to go out and go grocery shopping, or just being up and active, basically. Anything it took to actually keep me out of my bed or out of, not napping. And within about a week, I started feeling significantly better. And I'm sure it was probably a combination of the lifestyle changes plus medication changes. But within about a month, I started being able to actually do things and focus and accomplish just generally. I was feeling so much better, even than I had for a lot of the treatment, and I'm still dealing with fatigue. It's still like as soon as I stop being upright and active, as soon as I sit down, the fatigue all like rushes right back, and so it's kind of a challenge. I'm still trying to figure out how to live a functional, productive life with that kind of going on, because as I said, like for a lot of the work that I've been trained to do, computer science stuff, it's fairly sedentary work. So one of my my great oncologist from the treatment, Arthi Rao, she recently posted on Facebook her pithy quote, "Sitting is the new smoking," and I, for me at least, that is certainly a thing. If I am sitting and not doing, like if I'm not physically active, I am feeling very bad in a very difficult to quantify way very quickly. And so it's really difficult for me to sit at a computer and actually do productive work. I can sit at a computer and browse the internet all day, but that's not really, like, I'm kind of not feeling well while I'm doing that. So if I actually want to be working on stuff, I kind of have to be mentally alert and aware, and so that's a challenge that I'm figuring out. But so there's that. But honestly, for the last few months, I've been, as long as I've been up and active, I've just been having such a more positive mindset and experience, even than I had for most of my adult life. And I've been accomplishing a lot in terms of trying to put myself into the right position so that when I can actually get some of this work done, when I figure out how to do that, I've just got a number of different interesting projects in the work that I'm looking forward to sharing with friends and family once they're accomplished. So I've got a lot going on that I'm really excited about, and really, really enjoying life, and figuring out ways to try to be productive, try to get back to being functional and self-supporting. So that's a challenge that is I'm very fortunate and happy to be able to make, because I guess I could talk about that now. I guess like one of the things I tell people occasionally is that I'm very aware on a regular basis of how fortunate I am. I got to know a few different people during my time getting treated during the whole bone marrow transplant and chemotherapy before that, but that were in a similar situation in the sense that they were young people, whose lives had been very fulfilling and very productive, and were suddenly interrupted by cancer, and they were trying to get through that. And I got to know about 4 or 5 of these people through that experience, and among them, there's really just one other and myself that were really doing well, that were still alive, not too long after that. So it spoke a lot to how fortunate I was for the results that I've gotten, and I've seen what people went through while they were struggling with trying to get through that, and I had it really easy. So I know there are just many different ways that are difficult to talk about, partially because I don't have the personal experience with them, but I've seen how that is. And I don't want to inaccurately portray what it's like for someone to go through a much more difficult experience than what I had. So I'm aware of it, and it's just one of those things that I kind of remind myself on a regular basis of, there's that, and I'm very fortunate, and I'm just trying to make the most of what I can do with what time I've got, because there's no guarantees that I won't be relapsed anytime in the near future, and then I'll be going through all that again, potentially unsuccessfully, because if I do relapse, my prognosis is not good, because when you relapse after having cancer, that just means that whatever's still there is probably that much more resistant to being treated. So hopefully that's not going to be a thing, but my prognosis now is, about 3 years out, so I've got about a 10% chance to relapse statistically, and statistics are kind of a sham in a sense of that doesn't really necessarily mean that that's my particular chance, but it's just, that's kind of what the rough estimate is for a broad demographic. And so that is maybe another couple of years, my statistics would be more like, it would be more likely for me to die in a car crash than to relapse and to die from cancer. But for the time being, I'm still at an elevated risk, and so I'm still, very much aware of that, and I try to use that as motivation to accomplish positive things with my life. That's one of the tangible ways in which my life has changed through the experience, is that it's really given me a different perspective about the things that I value doing with my time, and what I want to be doing, and why I'm doing them. I used to, for example, be much more into watching movies and television, and I still do, but I don't nearly as much as I used to. Simply, like there was a period of time where I kind of lost interest in that stuff. It's like, why be doing that when I can be spending time with others or people that I care about, or working on something that gives me fulfillment, or that I'll look back at and be proud of doing, or that kind of thing. Watching another movie which retells the same stories that I've seen countless times already, just in different ways, you know, sometimes a good distraction, or a good way to relax or unwind, but oftentimes there are just other things that I'd rather be doing to get that same relaxation. So I guess that's one of the mental shifts that I kind of went through treatment, is just kind of reorienting some of my priorities, really giving me a kick in the pants, the realization that, yeah, maybe I don't have forever. Maybe I won't live infinity. Maybe I should actually start focusing on accomplishing something useful with the energy and time that I've got to work with. And yeah, at least for the last few months, once I actually got kind of success with my health improvements, that has been a real a thing. So I'm very much over the next few months hopefully looking forward to delivering on some of those projects, and actually be able to, the first time in my adult life, look back and be like, yeah, I did something useful that I'm proud of, and that has improved the world in some small way or whatever. So that would be fantastic. Let's see. Just going through notes here and trying to keep it brief. It's already at 20 minutes, so this recording's got to stop at 25, so I'll see if I can wrap it up real quick. Oh, one of the other fortunate things is I got on disability just out of personal realizations, medical expenses, medical results, advice that I got from people, my own introspection. I went on disability in July of 2016, a year ago, which meant, you know, after about a year that my employer had to let me go because they couldn't hold on to my job for that much time. So basically I was officially let go from CSC back in July of 2017. But I've been on disability that whole time, and I'm very much looking forward to hopefully getting off of it soon. If I can find a way to actually get back to work, which is what I'm working on a regular basis, then that's my plan. I've got a number of different projects in the works, some of which are potentially monetizable that I could use to actually maybe be able to support myself again. And I'm looking forward to hopefully being able to do that, and even possibly repaying the money that I've taken from not only my insurer but Social Security, because my insurer requires that if I'm on disability I have to apply for Social Security disability, which was granted. So now I'm taking money from Social Security that I don't want to be taking, and if I can find a way to pay that back, that would be awesome. But let's see. So actually, let me cut the video here because it's definitely going to take me more than a few minutes to kind of go into a rather summary of the other things I want to talk about, and I'm going to have a part 2, which will also probably be at least 20 minutes long, so sorry for that, where I will talk about the other things. So I'm just going to stop that now and then start it so the video doesn't stop itself automatically. So one sec.